supine with affected ear faced up. Then the next one is a tonsilectomy. Now, for those of you guys that weren't here, we do use a Mayo stand, but in specific, they actually will use a McIver self-retaining mouth retractor, which will use the Mayo stand to help us, assist with the, I guess, holding of place. This one has a really big tongue. Okay, but I'm just going to do this kind of a little bit. The biggest thing here, you guys, that you have to keep in mind is that once this is in place, then you cannot touch the Mayo stand. When I say cannot touch the Mayo stand, you can touch things on the Mayo stand, but you don't want to bump into the Mayo stand. So I'm always further away, but arm's length. So you're going to have a McIver self-retaining mouth gag on your Mayo stand. You're also going to have some sort of clamp. Usually it's going to be a curved Alice to hold on to what they're retrieving. So the tonsil, the adenoid, whatever. One thing that I actually failed to tell you guys the other day, sometimes they'll have a herd dissector. The herd dissector sometimes allows them to do blunt dissection of the area of what they're trying to, cut, that sort of thing. A herd dissector kind of has this curved little portion to it. Do you guys see that? And the other end is an elevator. Sometimes you'll have the Barnhill curettes to help smooth out and scrape that area. But what's missing from here is the laryngeal mirror. That, a lot of times they'll be a small or a large. So if it's a child, they'll want small. If it's an adult, it's a large. And then they have what's called an anti-fog solution, also known as Dr. Fog, because if you guys haven't noticed already, a lot of the things that we call certain things in the OR to differentiate them, we'll call them by like the general name and the manufacturer's name. So you'll also have this pad. As you guys can see, it's a radiopaque pad on the other side, or a radiopaque strip, just like your x-rays. So a lot of times some places will count this. And typically I'll put it right, if the patient or if the surgeon's right-handed, I put it towards the right side. If the patient or if the surgeon is left-handed, I'll put it close to the left-hand side. Sorry guys, this will actually be in. This is typically in more. But
the doctor does that though, right?
This part?
Yeah, we don't have anything to do with it.
The only portion that you actually have a say is actually elevating. So you really, if you guys don't have good control of how to move this, start practicing now. So most doctors are going to be right-handed. And then you put the anti-fog, open it, squeeze it on. I usually keep this on my back table because this will stay moist for a half an hour or so. And
at this point, what's on your back table? Considering on this call, everything you need is on the Mayo.
What will be on your back table will be your tray.
Okay.
But basically all that stuff there.
Oh, okay.
So everything that you need is going to be on your Mayo. Everything that's kind of a whole that they might need, or that's just in a typical tray, will be on your back table. So the things that you actually toss off, this will actually be at the always at the foot of the bed. And there are some cases, all your preference cards will say where the equipment needs to be. Foot, or the suction at the foot of the bed, microscope on left of the patient. So all of those little tidbits, and I know that all of you guys have done your preference cards and they need to be beefed up. That's kind of what she means. You need to know the exact position of where the equipment is too. So your suction and your ESU unit is going to be at the foot of the bed. So how you would have this, do you guys know what this is? What is it called?